and we're going to move on.
As you can see from the title of my presentation, it is going to be very provocative discussion. So I want to begin by stating what Dr. Morgenthaler has kind of gave a good overview, that testosterone is a chemical messenger. It's a natural hormone that is important for maintaining the physiology and metabolism of our brains, our skeletal muscle, kidney, liver, bone, hair, skin. And it's also very important for our vascular health. But I think what also people perceive less sometimes is that not only it's important for male reproduction, but also very important for sexual function. And this is an integral part of a human health. Sexual function is an integral part of a human health. As Dr. Morgenthaler has pointed out, there is interchangeable terms, hypogonadism, which you see up here. I'm sorry, if I can go back. Hypogonadism is equal to low testosterone or testosterone deficiency, and it's categorized clinically into three subtypes. Men with testicular dysfunction is called the primary. Men with central dysfunction, like hypothalamic pituitary dysfunction, is called secondary. But most of the testosterone deficiency is seen in older men, which we call age-related hypogonadism. And I just want to say one more word about this, is that the majority of men with low testosterone fall in the third category. Very limited number of men is seen in the first two categories. The prevalence of testosterone deficiency in the US is approximately somewhere between 5 to 14 million individuals walking the streets. And that's because it depends on the level of testosterone that is used and the population studied and the comorbidities. For example, the Endocrine Society, as you can see here, shows that 30 to 50% of men with diabetes or obesity actually have low testosterone. And the Massachusetts Male Aging Study, which you see here, shows that roughly 6 to 12% of men have low testosterone, because this is a population study. So let me put it for those who may not think about it as carefully as some who would, is that testosterone deficiency has a serious clinical implication. It has implication on sexual function. It has implication on metabolic syndrome. It has implication on insulin resistance and diabetes, which you hear from other speakers. It has an implication on inflammation, hypertension, dyslipidemia, vascular stiffness, atherosclerosis, and the end outcome is that low testosterone or testosterone deficiency increases mortality. I just want to highlight this, which is very important. This is published in Mayo Clinical Proceedings. This is the results from a discussion of an international expert panel. This is people who spend their careers studying testosterone deficiency and testosterone therapy. And what this panel came with, 9 resolutions. And the two that I thought are very critical is that testosterone deficiency has a detrimental impact on human health. I want to repeat, testosterone deficiency has a detrimental impact on human health, and it's well documented and well demonstrated. The other resolution that this panel came with is that symptoms and signs of testosterone deficiency occur as a result of low testosterone. And men may benefit from treatment regardless whether they're young, they're old, they have obesity, they have diabetes. Irrespective of the etiology, men may benefit from this. These are really important resolutions based on this panel discussion. So the crux of my argument here is that, does testosterone therapy in older men merit treatment? Should we treat older men with testosterone? Is there health benefit? If you ask me specifically, the answer is affirmative, yes. However, the FDA opposes testosterone therapy in older men. But however, they indicate it for younger men with the primary or secondary hypogonadism or low testosterone. So let's really look at the evidence. I think this is, we all have to really be critical here. Does the evidence show that older men benefit from testosterone? And if you look at the results of the T trials, which is the largest NIH-funded trial, 788 men were studied. The mean age is 72 years. to determine the efficacy of testosterone therapy in older men. And if you look at some of the results of these trials, the first thing that you really see, there is a definite and a huge impact on improvement on sexual function. Testosterone therapy improves sexual function in older men. What's wrong with that? Older men deserve to have a sexual life. They should not be deprived. The other important point that I want to make here is that testosterone therapy in older men improves bone health and bone strength. So bone mineral density and bone strength are very important in older men because you can prevent fracture and you can improve frailty. So I think this is another important health dimension that is improved by testosterone therapy. The other important observation, both from the T trials and from this study, which published by Christina Wang, is that testosterone improves positive mood. You feel better. You look at life better. It also reduces negative mood. You are less depressed and you are less tense. So this is a really, really profound, important aspect of testosterone therapy in older men. I think this is another critical piece of data, which is present in the literature in many forms, which is low testosterone is associated with the increased mortality. Testosterone therapy reduces mortality by half. And this is in systematic reviews and meta-analysis. This is in clinical studies. The data come together suggesting that testosterone therapy reduces mortality by almost half. An interesting and new observation that was published this year from the UK Biobank clearly suggests that low testosterone is associated with the increased dementia and Alzheimer's disease. Wouldn't it be time to consider treatment of older men with low testosterone with testosterone in order to decrease the incidence of dementia and Alzheimer's disease? I think this is going to be profound. Now, I know some may disagree, but this is really, really an important observation. So I want to come to my critical analysis of why testosterone therapy is viewed negative by some and positive by others. Well, in 2014, the FDA argued that testosterone therapy in older men is really is not needed. Men just get old, and testosterone deficiency is just a natural consequence of aging. It should be left alone. These are older men. What do they need to do? They just need to go to the pharmacy and the grocery store. They don't need to go participate in any other things. They're old. Let them take their life and forget it. Also, the FDA has this conservative stand that T therapy is only limited in men with primary and secondary hypogonadism, which is only a small fraction of the true number of men who are afflicted with testosterone deficiency. And this is really a negative view. Let me make this point clear. Most of the clinical study and the clinical trials in the US and Europe are actually carried out in older men, not in younger men. So all the evidence we have to date is actually as a result of our understanding of testosterone therapy in older men. And we know that it has huge health benefits and improves quality of life. So let me make this is really, really more clear. If age did result in low testosterone and is associated with a clinical condition, why should age-related testosterone deficiency be denied benefits of testosterone therapy? We treat macular degeneration, which is age-related. We treat hypertension, which is age-related, but we don't ask those questions. But here about testosterone, it's just this conservative groups and the FDA have this negative effect of testosterone therapy in older men. Let me clearly state this. Professional societies such as the American Urological Association, Sexual Medicine Society of North America, and the American Association of Clinical Endocrinologists, none of them recognizes age restriction for T therapy. They say if the man has a testosterone deficiency, it merits treatment. They don't distinguish by age. Only the FDA and some conservative groups do. Also, deficiency of other hormones such as insulin and diabetes and thyroid hormone, we treat those conditions. We don't ask if they are old or not old. That brings me to actually my final point here. The failure to demonstrate enthusiasm for testosterone therapy in older men may be based mainly on ageism. It's almost like a discrimination. Older men don't really need to do much, so why bother treat them? I don't think this is fair. I don't think this is right. I don't think this is clinical medicine. The overwhelming evidence from the recent T trials tells us that testosterone therapy is very important for overall health and sexual health. Also, the diabetes trials, which you will hear about them, they also tell us that testosterone therapy improves overall health and sexual function. So maybe this negative view is viewed because they think since it improves sexual function in older men, this may be inappropriate pursuit. This is really absurd. And that's one of the reasons why the title of my talk is The Absurdity. This is absurd just because improvement of sexual function in older men, that doesn't mean you cannot treat them with testosterone. I want to end by quoting Voltaire. It is very dangerous to be right when the government is wrong. And thank you. This is my final slide. Thank you.